Welcome back to the Studio 2121 podcast. I am Chase Morano, and I'm here with Hollyann Johanson, who is the director of our Medical Assisted Treatment Division, or MAT, as it's so affectionately referred to. Holly, how are you doing?
Good. Thank you for having me.
Thank you for sitting down and having this conversation with me. I wanted to have a conversation about MAT and what it is and who it serves. Could you maybe take it from there?
So our Medication Assisted Treatment Program, or our MAT program, is for individuals who have been diagnosed with an opioid use disorder. And we also have one medication that is for individuals who've also been diagnosed with alcohol use disorder as well.
Yeah, so you work with 4 different medications. Could you maybe go through those individually and tell me how they work and who they might be intended for?
Sure. So our most widely used medication in our program is Suboxone. It's for individuals diagnosed with opioid use disorder. It's a preparation of buprenorphine and naloxone. So the buprenorphine binds to the receptors in the brain and helps them, with like reducing their cravings so they don't have cravings to use. And then with the naloxone, it actually blocks the effects if they were to use an illegal substance, opiates. If they were to use that, it would block them from being able to get high or feel the effects from it. Our second medication that we have is Sublocade, which is a monthly injection of buprenorphine. That comes into different doses, 300 milligrams, 100 milligrams. It is just a preparation of buprenorphine. It does not have naloxone in it, so it has the medication that binds to the receptors, but it does not have the blocker in it. We also offer Brixadi, which is our newest medication. We're very excited about it. We've had quite a few clients start on it, and we've only heard really great reviews. So as a program, we're super excited about it. So Brixadi is it's a weekly or a monthly injection of buprenorphine. All new clients start on the weekly dose, and then eventually, after we know that they're doing well with the medication, they bump up to the monthly dose. There's actually different doses that they can use based on what the provider thinks is appropriate for them. But eventually, like I said, they'll bump up to that monthly dose, and we've had, great success with it. And then our last medication that we offer is Vivitrol. It is a monthly injection of naloxone. So it doesn't have the medication that binds to the receptors. It's just the blocker. And that medication is for clients diagnosed with opioid use disorder as well as alcohol use disorder. So it helps with both.
That's really interesting, and I'm fascinated by the neurochemistry that you get to work with in your job. So these medications, these are for someone that has made the decision to become sober, but is anticipating maybe there might be relapse periods or some difficulties along the way,
Sure.
correct?
Yeah.
Do you think one of the biggest things blocking people from accessing this treatment is stigma? Just this idea that substance use disorder or addiction plays out in the public imagination as it's either a purely socialized or individual problem, or it is a purely physical problem. And I think Westbrook is really good at taking a firm stance and a holistic approach to cover both our bases. So no matter what someone's opinion of it may be, we're covering both sides. And I think that's really impressive.
Yeah.
So yeah, do you think it's just the stigma coming in? Do you see that in your clients, or how do you walk people into getting started?
Yeah, we absolutely do see that. Unfortunately, we hear a lot of times that, our program is just trading one addiction for another, which is completely untrue. We have a lot of people that come in and have, no social supports or very limited social supports because maybe, their family or friends that are close to them don't believe in using MAT, or say, you should be doing an abstinence-based program. We try to help our clients, when they come into our program, we try to help them understand that their recovery journey is their own. And, obviously everyone wants to listen to the opinions of the people they care about. But we want them to understand that, if this is how they need to go through recovery to make it successful for them, then we're going to be their support through that process. We want them to know that they have support so that they can keep going. We understand that, in some instances, relapse can be a part of recovery. And we're here to help through that journey. We definitely help our clients understand that even if they have a slip during that process, Westbrook is the best place that they can be to continue with that treatment. So we try to help them understand we are here to support you no matter what goes on. Every time you walk in the door, you have support from your case manager, your provider, your therapist, whoever your treatment team looks like. And then, we understand as well that when you go home, times get tough. And if you don't have support at home, maybe you need somebody to talk to. And we have our crisis line that we offer to them, and we let them know you can use this 24/7 if you need it. So we make sure that our clients have all the resources that they need so that they have that support. We let them know about IOP, we let them know about CES, whatever, other program that they could benefit from. We let them know that there are other options out there too that go right along with your MAT treatment, and you should be using those.
So one of the unique things about medical assisted treatment at Westbrook is that we serve 8 counties, and some of those counties are really rural and remote areas. Do you want to talk a little bit about the mobile program and what you guys do with the MAT mobile unit?
Sure. Our mobile unit is a fantastic resource that we're able to soon again use in the community. We did have a hiatus just due to some licensing issues that were going on. However, we hope to be back on the road within the next month or two, which is really exciting for our program and for our clients. Before we had to go on hiatus, we were able to take the mobile unit into, we were set up in 2 of our rural counties. So we went to Wirt County on Mondays, we were in Tyler County on Thursdays, and we're able to take our services to our clients. Transportation is a huge issue here in West Virginia, and even in Wood County, transportation can be difficult because the bus route doesn't cover the whole county, which, it can be really frustrating. So being able to take our mobile unit to our clients and have them come to, the hospital to seek our services, and then, that's allowed us to help set our clients up with primary care through Sistersville General, which is awesome. So, those clients can do any MAT services on the mobile unit. They can do case management services. There is a peer there usually, so that if they need, additional support through their recovery from someone who has maybe been in their shoes before, they can seek peer services. They do their doctor's appointment from the mobile unit, and then we can also set them up for individual therapy services to do telehealth with a therapist as well.
I've been really impressed with Westbrook's commitment to serving people that are otherwise isolated.
Mm-hmm.
I think one of the great things about bringing care to people, these are people that might not have access to good transportation,
right,
that might have a real tough time getting a job, might not have internet connectivity in some cases,
mm-hmm.
and we're starting to get out in these areas and build community,
right,
from the ground up. So you're connecting them not only with our services, but primary care providers.
Yeah.
You're advocating for the population as a whole, so if they have other people perhaps in their own lives, family or friends that could benefit from the program,
sure,
you're being that touch point, and I think that's admirable.
Yeah, it definitely makes a huge difference, especially in the rural communities. It's allowed us to have really good partnerships, like I said, making the referrals for primary care, and it allows us to help advocate for our clients too, to help them understand, there could be a plethora of physical health issues that you have not addressed because you've been addressing your addiction up to this point. But, maybe let's help you get scheduled for a dentist appointment. What day do you need to go? And we'll see if one of the peers can take you. So we have the flexibility for that, which is really nice, especially in the rural counties when sometimes you have to drive up to an hour to get to your nearest treatment facility.
Yeah. So to anyone that's interested in getting into the field or, interested in working at Westbrook, what would your advice be as someone that's come so far in your own journey?
Definitely helping them understand that you have to have an open mind when it comes to our program. Everyone has ideas of the way that things should be, but when we're working with our clients, everyone is going through a different situation, and some people come in and see us at their very lowest, and some people come in and have a great amount of support. Either way, we're here to help those clients with whatever they need. But if you're going to be working this, with this population, you need to be aware of, some of the trauma that they've experienced, and helping them understand that, like I mentioned support, a bunch of times now, but it really is about support and helping them understand, this is your recovery journey. We're here to help you on that recovery journey, but, you're putting in the work here, and we are assisting you on that journey. but definitely keeping an open mind, and then helping them through the hard times. Every day of their recovery journey is completely different, and some days are going to be a lot better than others. And, we just roll with it and do what we can to help them.
Yeah. When you think about someone who has never been to treatment before and may happen upon this online or in our lobby, what advice would you give to someone who is grappling with these issues and making that decision?
Just call us. Even if you're not ready to make a decision right now, and even if you're not sure if MAT is what's right for you, we will absolutely help connect you with whatever service would be right for you.
Thank you for tuning in to the Studio 2121 podcast, brought to you by Westbrook Health Services. Check us out on Facebook and Instagram. You can find more of our episodes on YouTube, Spotify, and Apple Music. Thanks for tuning in.